Well, building on the success of its first massive surgical marathon performed on Mandela Day, the Gauteng Health Department hosted the second surgical marathon across 23 public health facilities. This was yesterday. It's aimed, I understand, at reducing the backlogs across the province. For more on this, I'm joined by Surgical Marathon Project Coordinator. It's good to have Dr. Nthabiseng Makgana back on eNCA with us. Doc, good morning to you. So the first one, quite a success. Yesterday, it seems, and tell me why it's being touted as such a success. Where was it exactly? Just remind me.
Well, good morning, Gareth, and good morning to all the listeners. So we've had the surgical marathon in 23 hospitals. Most of the hospitals that did actually participate were Bara, Steve Biko, all our regional hospitals, most of our regional hospitals, and then including some of our district hospitals that are actually being utilized by, our hospitals like Bara that use Bheki Mlangeni to see some of their patients. So it was actually quite a big success, seeing that we are able to reduce the number of patients that are actually on the waiting list.
So when we say a surgical marathon, just help me understand, what does that look like? Have you got some poor surgeon standing in a theatre for 12 hours just knocking out surgeries, or what does this actually look like? I'm trying to imagine this in my mind.
Okay, so Gareth, just to put you in the picture, including the rest of the viewers. So when we're saying a surgical marathon, you can imagine a health establishment does surgeries on a day-to-day basis. And so when we do a marathon, we are saying that we are doing above and beyond what we are used to on a day-to-day basis. So for example, if an institution is able to do 20 surgeries in a day, and that's their capacity, they then say to themselves, let's push a little bit more and would add maybe 5 more. And that's what a marathon then means, that we are doing above and beyond the general work that we usually do on a day-to-day.
I think this would go without saying, but I can imagine some people sitting at home on the couch gasping, thinking, hang on, does this mean you're racing through surgeries? Does this mean patients are at risk? I can't imagine that is the case. No doctor, no surgeon's ever going to do that, surely.
Not at all. Actually, we are saying that we are bringing more healthcare workers onto the projects. We get more equipment. We get more, consumables. And when we're saying, we are then saying that if, for example, we do 20 cases, then on that day we're doing 25. That means that we're going to get extra people that are available on that day to say that, can we then push the bar a little bit further? Remember that the surgical marathon behind it is that we have noted that our patients wait longer, and in them waiting longer, obviously there will be a bit of a dissatisfaction. So the Department of Health says, how do I mitigate? And that's when we came up then with the issue of saying, under the guidance of the MEC, to say, let's do surgical marathons. Let's actively look at making sure that patients are actually being done surgeries, and where are we? Gareth, we are then proud to say that from December 2022 to January, you could remember that we were sitting at about 32,000, and now we are close to halving that waiting list. So I think there is quite a lot of work and positive work that is being done.
I was about to ask you that waiting list when we spoke back in December. I'm glad you reminded me, because I knew it was a few 10,000, but I couldn't quite remember the numbers. So I'm glad you reminded me on that. Doctor, it's not to take away from these surgical marathons and the incredible work being done on a day like that at 23 facilities, but there are going to be critics, and I'm sure many of them watching now going, well, why can't you get more experts? Why can't you get more machines, more technology, and do this every day? Clearly you can. You know what I'm asking you. There's going to be the critics saying, but surely we can do this every day. Why aren't we doing it? Why only for a surgery marathon?
Absolutely, Gareth, and perhaps mine then will post back to them and say, how about we then look at the social aspects of our country? You get to patients that we can't get to because there's so much trauma. A patient that would have been booked for an elective knee surgery, knee replacement, you end up not being able to get to, maybe simply because there was a car accident due to drunken driving. So then we would then take it back, because health is actually then, it is actually informed by public behavior. We go back to why we've got so much cataract. Patients have a lot of cataract simply because of lifestyle. So let's go back to saying, how about we make sure that our public health education, we make sure that our primary health is actually strengthened. We do preventative medicine before we then get to a point where we have to deal with the fruits. So let's deal with the roots.
Let's talk for a second about the resources, Doc, that is able to be brought in on the day, because it's now happened for a second time as well. Where do the extra surgeons come from? Where does the extra equipment and the technology come from for a day like yesterday? Where do you get the extra gear from, the extra human resources?
Because we are a highly reliable organization amongst ourselves, we are able to pull resources from each other. What we have done is that there are cluster heads. We've got, from Charlotte Maxeke and Steve Biko academic hospitals. These cluster heads are able to then, distribute resources, especially human resource, where they say that I might have a human resource, but I don't have a theatre availability on that day. But you, as a hospital in a district, you have a theatre that is available. Therefore, we are then saying, as a cluster head, I'm going to send some registrars, I'm going to send other doctors to your hospital to support. For example, Betha Klowa and Charlotte Maxeke Academic Hospital are doing this very well, where we say that Betha Klowa has the infrastructure and we have some capacity when it comes to human resource at Charlotte. So how do we then bridge the gap? We bring them together and we're able, that's how we actually work around it.
How do you decide as a department which surgeries you're going to perform? How does it work on the priority list? Or do you just keep going down this enormous list based on name or based on type of surgery? How do you decide who gets the surgeries on a marathon surgery day?
So these obviously are based on the electives, and we will then take from the oldest waiting one. That's the one that will be prioritized to be done. But Gareth, perhaps what we'd also want to do as a department, we have then decided under the leadership of the MEC and the HOD to say that let us then make these thematic as well, so that the impact is also felt even more. Where we'll say that we'll have a surgery marathon that will be done perhaps for cataracts, and we are saying that our target for the month will then stay it, and we are going to actually start this in September, Gareth, and we hope to get another slot where we then talk about the cataract surgeries that we have done in the month of September, so that we are able to say, because those are one of the biggest waiting lists that we have, cataract surgeries, including arthroplasty.
Yeah, it could be based around almost World Eyesight Day or something like that. Okay, I understand the thematic of this as well. So you're mentioning September. I was about to ask you, I just want to make sure I understand, Doctor, as I say goodbye to you. Is that the next surgery marathon day, or is it not decided as yet?
So the next surgery marathon day will be in September, and we will then be doing cataracts. Okay. And obviously then October is coming up, Gareth, then we'll then push in terms of your cancer-associated surgeries, though those ones do most of the time crash lists because they are then deemed as urgent more than others. So obviously, depending on the clinical background and what the patient might be coming with, then we are able to then, crash lists depending on the emergency thereof. But for cataract, we'll be doing that in September.
Okay, it's good news, because we know how many people need that in South Africa as well. Keeping it themed, I think it'll get a lot more attention and people understand then exactly what you're doing, and it gives you some targets to aim for as well. The project coordinator for the Gauteng Health Surgical Marathon. It sounds like it's fun, but I'm sure it's not good fun for the surgeons working all day. But well done to everyone involved. Dr. Nthabiseng Makgana, as always, I'm sure we'll talk again. So it is very, very good news as far as September is concerned. Cataract surgeries, we know how expensive they are as well. We know the waiting list for those. So we'll follow up again come September.